Hi, Piedmont Park community. We are honored today to have Dr. John Andrachuk from Northside Hospital come and talk to us about orthopedics, Northside Hospital, as well about an exciting upcoming program for Move Mondays, which will happen in September and October of 2020. Welcome, Dr. Andrachuk.
Thank you.
Before we get started, I would love to just give you a brief moment to introduce yourself and what you do with Northside.
I'm an orthopedic sports medicine specialist working at the Midtown and Sandy Springs offices. So I specialize in sports medicine surgery, so the treatment of injuries in generally active people in soft tissue, ligament, and joint injuries, those kind of things.
Awesome, thank you. Tell me, what is sports medicine, and is it just for full-time athletes?
So sports medicine is a study and treatment of injuries that occur during sporting activities. It isn't just for athletes because the same injury can occur in someone from a different mechanism. But what it's done is given us a skill set to address specific injuries. So for instance, an ACL tear that occurs as a result of a fall, that skill set applies to the athlete and to the non-athlete. But the same technique is involved, the same surgeon would do that procedure. So even though we call ourselves sports medicine specialists, you don't have to be an athlete. We just deal with certain types of injuries that are often seen in athletes, but can be seen in non-athletes as well.
Okay. Well, I know since the pandemic, I've been working from home since about middle of March. And the other day I realized I've been working from home for a really long time. And I know I'm not getting enough steps. And when I did start going back to the gym, it was much harder than I expected after months of not moving much. What advice do you have for moving from a sedentary to a progressively more active lifestyle?
Go slow. So whatever you do, I progress slowly. I wouldn't jump into anything too fast. So if it's running, start with a walk, jog, increase your distance slowly with time. If it's the gym, really start with the lighter weights, fewer sets, and increase it slowly. Otherwise, you're probably going to get injured or at least hurt and set back your training. And just be patient because it'll get there, but you do get deconditioned pretty quickly. And so just the consistency and the gradual progression is what's really important.
What are some patient trends that you're seeing during the pandemic, and why is sports medicine important right now?
I'm seeing a lot of lower extremity injuries. So a lot of people are going out hiking and doing other activities that they weren't necessarily doing before, and they're twisting their ankles, they're fracturing their ankles, maybe tearing their Achilles tendons. So certainly the volume of that has gone up. I think where we serve a role is when people come in and they have those aches and pains, to understand whether it's something that they can just kind of work through, that it's maybe just from overuse, or maybe it is something more important, needs further workup or perhaps treatment. So that's what we're here for, is really to help people keep on moving, keeping active, and kind of doing what they love.
I know that I've been hiking a lot more during the pandemic, and I have more plans. We actually are making a hiking calendar for after the first day of fall, so I can definitely see why that would be a trend. Well, I think a lot of us could really use something positive to work towards. How can trainers and health professionals help someone who just wants to advance their fitness goals?
There's a few ways they can help. One is just through motivation. Having a schedule where you're seeing your trainer gets you up out of the house, making sure you're doing something. They can help to motivate you. But I think kind of the main role is to help you set metrics and appropriate targets, and critiquing what you're doing so that you're doing the exercises appropriately, not hurting yourself, and allowing you to progress in sort of a safe manner.
That makes sense. So tell us, what can Piedmont Parks community look forward to in Move Mondays with Northside Hospital?
So Northside Hospital is honored to partner with Piedmont Park on Move Mondays. Through the months of September and October, we're going to be sponsoring a number of events focusing on physical activity and keeping an active lifestyle. It's kind of consistent with what the messaging of Northside and the Northside Hospital Orthopedic Institute is all about: keeping moving, keeping active, and keeping healthy. So we're going to be doing things like high intensity interval training sessions, pre-running exercises, at home or office stretching programs, things along those lines through those Mondays.
Thank you. I'm really looking forward to the home office stretching. I know that I could do much better where I'm sitting and what I'm doing throughout the day. My work commute has turned into a few steps, and I'm really excited to get moving. So thank you. Is there anything else you wanted to add?
No, that's it, Amy. Thank you.
All right. Thank you. Have a great day.
You too.